The gentlewoman yields back. Pleasure to recognize the gentleman from Georgia, Mr. Carter, for your 5 minutes, followed by Mr. Doyle of Pennsylvania. And I don't have any other members on tap, so take it away, Mr. Carter.
Thank you, Madam Chair, and thank you, Dr. Posick, Dr. Deeks, for being here. We appreciate this. Dr. Posick, I wanted to ask you, in your written testimony, you mentioned that many of your patients are young adults and adolescents. Why do you think that is?
Well, young adults, certainly. We're not a pediatric clinic, so haven't been seeing adolescents, but, you know, I think it reflects potentially many things. We don't know if perhaps younger people are more susceptible. There are, as was referenced before, a large number of people in the 18 to 39 age group who have been infected with COVID. As time has gone on and older individuals and at-risk individuals have been vaccinated first, we've seen the age profile of our clinic population shift down. It's also possible that that sicker people with more comorbidities at baseline and a higher level of disability at baseline don't register the changes to their health in the same way that a healthy long-distance runner who was working full-time would, right? So some of it is where you started compared to where you are. But I do think that there are, especially now, a lot of young people who are getting newly infected, unfortunately. And that's reflected by the patient profile that we're seeing in our ICUs as well, to some extent.
What are the treatments that are working?
I don't think that we can broadly say that there is any treatment that is working for all patients. We don't have that answer yet. You know, as Dr. Deeks had suggested, there are things we try empirically. Sometimes they work for some patients, other times not. But we're not in a position yet to say that this is the regimen, this is the treatment that works.
You mentioned something a little while ago that concerns me, and that has to do with about how can we ensure that we don't have a stigma that develops along with those who have long COVID? I'm very concerned about that, and obviously you are too.
This hearing is an important place to start. The fact that you've invited patient panelists is incredibly important and sends an incredibly important message to the establishment and to our whole community. But I think that, again, naming has a powerful message. So arriving on agreed upon terminology for what patients are experiencing, then going on to create our best guess at clinical criteria for what that is important, so that we can acknowledge and validate what people are experiencing.
Dr. Deeks, any comments from you on that?
I am passionate about that last question. You know, HIV, we treat HIV, but people with HIV have stigma. It never goes away. And maybe a couple days of living in that kind of environment, but years of feeling it wears you out. Huge impact. So we have got to destigmatize this syndrome. Give it a name. Find a mechanism. Have congressional hearings. Have the NIH devote $1 billion to it. This is all good. And all the media that's happening, because these very powerful patient groups, their impact is through the media, right? The New York Times, Washington Post have been covering this extensively, and that's partly why we're here today. So the stigma is something we're fixing, and I cannot overemphasize how much respect I have for this group spending an entire day talking about this. I can't get doctors to spend a whole day talking about this. So what you're doing today is very therapeutic.
Well, and thank you both for mentioning that about the stigma part of it. I mentioned in the first panel that I've got a dear friend who is unfortunately suffering through some psychotic episodes and mental health issues as a result of this. And And that concerns me because I'm very concerned about his health, but this is real. I think a lot of people said, oh, I had COVID and I didn't even know it. And they just kind of passed it along as being something that's not serious, but it is serious. And it's something that we have to take seriously. So thank both of you for being here today. And thank you, Madam Chair. This has been a truly bipartisan hearing and a good hearing today. So thank you for this. And I yield back.
The gentleman yields